the title of my talk is NETPH and the Future. NETPH is the North African, Eastern Mediterranean and Turkey Public Health Network. This is essentially a website that we've been developing that puts together all components of the RESCAP-MED project. The fellowships, the workshops and training materials and information from the Symposium as well. And what I'm going to talk about is some of the background, because I've been privileged really to work with this collaboration since 2007, from the MedChamps, the initial research project in the region, to RESCAP-MED. But now we're at a stage where the RESCAP-MED project is sadly coming to an end. The EC funding is ending. So we need to think about the future and sustainability as well. So I'm going to try and give that overview of some of the work that has been done, where we are and where we could go next. And hopefully that will lead into the roundtable discussion for you all to participate in the future of this collaboration. So I'm dividing my talk into three main components, three main elements. I'm going to talk about the beginnings from 2007, when we first started writing the grant, the MedChamps project grant at Newcastle University in the UK. MedChamps stands for Mediterranean Studies of CBD and Hypoglycemia. It's just an acronym that you need for an EC project. I'm going to go on to talk about here and now why we've all been able to come together today, and that's the RESCAP-MED and NETPH project in this region. And finally, I'm going to talk about the future, how we can actually sustain and build on our web vision, our website, our network, assuming we want to, for NCD capacity development in this region and potentially even elsewhere as well. So I'm going to start by talking about the MedChamps project, which I was the principal investigator of as a senior lecturer in epidemiology at Newcastle. And we were extremely fortunate, I think, in being able to bring together some of the links we had. I had worked with the Turkish team before, and some of my collaborators in Newcastle were already working with the Syrian Centre for Tobacco Studies, and also had worked with the ASIDE team in occupied Palestinian territories. So we were extremely fortunate in being able to combine our various collaborations together into a broader network, which, as you can see, was quite well supported by the EC. It lasted for 4 years. It was quite well supported, and it included all the partners that are involved in the RESCAP-MED project, with the exception of Just in Jordan, and of course our home institute, AUB, in Beirut, that joined the RESCAP-MED project later on. So many of us have in fact been working together since 2007, developing these ideas when we first wrote the grant application. This is the very broad MedChamps aim, which you've seen before, Peter showed yesterday, but I've just highlighted a few key words that I wanted to focus on. So what we were aiming to do was to be able to make some recommendations about policies, about policy initiatives, both within and outside the health sector. So Habiba mentioned in the earlier presentation how important intersectoral collaborative approach is in public health for NCDs. And those that are likely to be most cost-effective and effective, taking into account the regional context and the burden of CBD and diabetes in each of the 4 partner countries, Palestine, Syria, Turkey and Tunisia. So we started off with a conceptual framework, and I must thank Nigel Unwin for this slide, because he coined this slide and drew it originally. And we called this the Policy Effectiveness Feasibility Loop. So what I'm really trying to get across here is that the initial conceptual framework was focused on having a real impact and being able to make recommendations about what interventions would be likely to be most effective in each country context, and also that the project was multidisciplinary. So it started by reviewing the burden of disease, CBD and diabetes, and the main risk factors for those diseases in each of the 4 countries. And it went on to develop epidemiological models, such as a diabetes model, CHD impact model that Nigel mentioned yesterday. These explain incidence trends or mortality trends based on risk factor trends and treatment uptake and effectiveness where available. But there was also a very, very important and large qualitative component, a situation and analysis led by Peter Phillimore and Shahada Zaman in Newcastle, which looked at several levels of conceptualisation and actualisation, stated and real policy, health coverage, release experience and opportunities based upon key informant interviews, document analysis, clinic observations and discussions with patients, for example. Having got very large kind of data sets based on the epidemiology and on the situation analysis, we carried out a detailed option appraisal and selection phase with policymakers, which has been published in press by Rural Uganda in the International Journal of Public Health, with the BSI team led on developing the option appraisal part. And therefore we go around a loop to be able to evaluate those interventions and look at future trends in the burden of disease and risk factors. Of course, our ability to evaluate things was rather overtaken by the conflict in the region, but we believe the model still has some resonance and utility. And as well as it being important to point out the project was multidisciplinary, the other factor I want to point out is that policymakers were involved at all stages, as external advisors on our project monitoring team, as key informants in the situation analysis, so as research participants, providing access to documents as well. And they were very highly involved in the option appraisal and selection process as well, so actually selecting interventions for future development based on the epidemiology and situation analysis in each country. I'm just going to give you a brief flavour of some of the key results from MedChamps very quickly. So the analysis of CHD mortality trends you can see as being quite widely published, mostly in open access journals. What we found was some small increases in CHD mortality in Tunisia, albeit starting from a low absolute baseline level, a more substantial increase in Syria, a decline in the West Bank, a small decline, and a more significant decline in Turkey. Now this was over roughly a 12 to 15 year period from the mid-1990s to the late 2000s. The exact years vary slightly between the countries. And it's largely explained by the risk factor trends. So in Tunisia and Syria, broadly speaking, blood pressure and cholesterol increased. In the West Bank, OPT, and Turkey, broadly speaking, cholesterol and blood pressure declined. And there was also a small contribution from community treatments as well. You saw this slide yesterday, Nigel showed it. I think it's particularly important to point out that the forecasts we have, both for Tunisia and for the other countries as well, which have all now been published, suggest very substantial increases in diabetes burden. And this is based, of course, on the increasing obesity trend and continuing high smoking prevalence in most of the countries, but also, to quite a large extent, population ageing as well. So over this 30-year time period in Tunisia, our projections suggest that diabetes prevalence could increase from around 12% to almost a quarter of adults, type 2 diabetes. I pointed out we made a very explicit aim to try and involve policymakers explicitly in various different ways in our project, and that included policymakers from EMRO, for example, from WHO Geneva. They advised on the content, the direction, the key information and the data sources. Obviously, in some of the countries, the actual evaluation of that was taken over by the conflict and what happened, but we did get the policymakers to actually appraise our policy options in a multi-criteria decision analysis in a way that they found feasible and practical for future use as well. So talking about our key outputs, this is what we presented to the EC. We had a significant number of peer-reviewed publications, many of which were open access. And I think it's worth highlighting that 8 of those were first author publications written by early career researchers from this region. Now you may think that is not that many, considering RESCAP-MED is a capacity building project, but MedChamps wasn't, it was a research project. And we were actively discouraged from having a training role within that project. So within that context, I think it's quite impressive. Some of these articles have been highly accessed, particularly the ones looking at trends in diabetes and CHD in Syria. And there may be some conflict, some interest in the conflict that's partly driven that. We have a journal supplement in the International Journal of Public Health, which is just about to be published early next year with 8 articles and an editorial. And of course, we've given many presentations, particularly Professor Bieber, for example, Fouad, media interviews, started to develop iPhone apps, M-apps that we spoke about earlier, and engaged with many different groups in lots of ways. But talking about some of the softer achievements, other achievements, we've formed a neuroproductive consortium that currently have a lot of momentum, although we're sadly coming to the end of our funding. We've carried out a large amount of capacity building now with RESCAP-MED, and particularly in qualitative methods, where there wasn't such a strong research discipline when we started the MedChamps project. We have a huge amount of materials. The epidemiological models we have for CHD and diabetes can be further developed and mined. The situation analysis can also be developed further as well. And these have been used for educational training and career development purposes, and also as part of the RESCAP-MED project. And of course, we were extremely lucky with a fantastic application from Peter too in getting EC funding from the RESCAP-MED project, which has generated the NETPH website. And my next few slides are really going to just talk about this website, what it looks like at the moment and what it's aiming to do. And before I start, I should perhaps highlight that this website was badged as a pilot project with limited resources, which we would evaluate now at this stage of the project and see where we wanted to go with it. So the aim of this website that we called NETPH was to encourage interaction between public health specialists in this region, North Africa, the Eastern Mediterranean and Turkey, to provide some training materials for public health professionals, and particularly junior early career researchers, and also public health professionals from outside academia as well. And to provide a detailed literature library of relevant material focusing primarily on NCDs and public health in the region, which I'll focus a little bit on later on because I suspect people are not aware of that. And also just to provide news, reports and features relating to NCD public health. So we do talk about, for example, why we focus particularly on NCDs, and what the overview of our aims are here, and also linked to the RESCAP-MED project. So this is essentially the front page, and it looks quite typical with a menu bar across the front, showing the links and sections that we actually have. So we are a public health network with news, training materials, events, NCDs and displaced populations, sections on ongoing research, links and publications. And if you scroll down, you see on the front page, we try and make it as interesting as we can, with pictures, with news that actually rotates. So if you go and have a look at the website now, you'll see that the news articles are actually different from here, where we downloaded a few days ago. We have links to our Twitter website, and links at the bottom to our Facebook group as well. Okay. And of course, many pictures of the refugee situation, workshops, physical activity, for example. So if we move on, I'm just going to take you briefly through what is actually here at the moment in this pilot. We've gone through about. If I look at training materials, one of the things that we clearly wanted to do as part of a capacity building project was to make the training materials that we had developed during the MedChamps project, and also materials developed specifically for this RESCAP-MED project, available to the workshop participants, of course, that attended the workshops, but also to a much wider audience, so to other people in the region that could not necessarily attend the workshops, and to try and make them as far as possible standalone, so that people could work through them in their own time. Some of you will know that we have a registration process, which is just to download training materials. Anything else on the website can be freely viewed without giving us any information at all. But to fulfill our requirements for evaluation, we actually ask people, before downloading any materials, to just give us some very brief information about their job and their email address. So our training materials are essentially materials that have been developed from the MedChamps and RESCAP-MED project. We know they have been downloaded many times, which I'll talk a little bit more about later. We have quite an important, we place a lot of emphasis on having news and updating and revolving our news, because the literature review and initial evaluation we carried out suggested that news and changing news is the kind of thing that brings people back to a website. Okay. So we had information on relevant events there, World Heart Days, opportunities for researchers, travel fellowships, and recently published papers of interest that we know about. And those are our own papers and other papers as well as upcoming events, for example. In terms of the events, obviously we have a list here which includes our current events. It includes the events we have tomorrow, the Public Health Faculty Conference here, and other events of global significance as well, such as the World Tobacco Congress elsewhere. And also, of course, news articles around NCDs and displaced populations, for example. We didn't conceive of there being a section on NCDs and displaced populations when we initially drafted this in 2010, but because that's of primary importance, as we've heard a lot about the refugee situation, refugees and IDPs in Syria, and we've reflected that by adding in this section on our website, which talks about the conflict-driven displacement. We use infographics as much as possible to show the impact on the EMR, and also point out that the NCDs and chronic conditions tend to be neglected, which gives them an initial chance to start writing and getting their work published and highlighted in a very kind of friendly format. And so we try and give them a platform to begin their research careers in that way. We have links. We have a section called Links as well, which contains links to all our partner institutes, for example. And we have a wonderful map here, but I can't show you it. And it contains links to key funders, for example, and it includes links to other websites that we know have similar objectives, the MENA Public Health Forum, NETPH, NET, for example, in the region. Is it coming back? Yeah. Oh, wow. That's about where I was with our pictures of the articles we have on ongoing research, for example, on type 2 diabetes complications in the OPT. Sometimes these include write-ups of local events, public health conferences as well, for example. We have the section on links, the maps I mentioned, the links to our own partners, the links to funding bodies, and the links to other networks and websites with similar aims regionally and globally as well. And finally, I'd say something about publications, because this has been quite a large area of work for us, something that we spent some time on. We have publications which include peer-reviewed publications relating to NCDs. We have reports, official reports from organisations like the World Bank and WHO, and our project newsletters, and these are in separate sections. And the first section's on our peer-reviewed papers. We've tried to give everyone little symbols to help people actually identify what might be most relevant to them. So our little heart means it's around cardiovascular disease, the glucometer means it's broadly about diabetes, the dollar sign, health economics, the set of scales and the cigarette, I hope are self-evident. And if anyone could come up with a better symbol for health policy, that looks like a bit like education for me. We'd be very grateful to hear it. But we spent a while actually working on a resource here that could be highly useful, and we would like feedback about the utility of that and how to publicise it further. Of course, we have reports as well, like the Global Action Plan for Prevention and Control of NCDs. And we are continuing to try and highlight the work that we're doing through our Facebook groups, the Eastern Mediterranean Network for NCD Research, which as of half an hour ago now has 299 members. So it's reasonably active, has been growing steadily. Our Twitter network, NETPH, is slightly less active, but it's still also growing. Obviously, we're only tweeting in English, which is a limitation. And just for the last couple of minutes, I hope I'm not running on too long now. I got a bit distracted by the lack of screen in the middle. I want to just mention that we are trying to carry out an evaluation. This was just a pilot project, but we do have information because we asked people to register to download materials information from the 246 individuals who've registered to download our training materials. So, for example, we know where they're from, and most of them, interestingly, are from Jordan, although we also have a lot from Malaysia, although we don't know why. We have a little bit of information about their demographic characteristics. There's slightly more women than men. We don't know much about their age groups because the majority of them didn't want to tell us that. Yeah, we don't know. But nevertheless, we think that they are relatively junior researchers on the whole, because when you look at their educational level, most of them describe themselves as educated to BSc level or being students. So we think we've broadly targeted the younger researchers, but we haven't actually targeted the non-academics. They still tend to be university people. So that's an area where we haven't performed quite so well. In addition to knowing about our registrations, we also have Google Analytics that can tell us where the traffic comes from. And it comes from the UK and Jordan at the moment. And I guess we're working on it in London, and Jordan have been the biggest user. But we have representation from all over the world, have come to look at the website, apart from Sub-Saharan Africa and Mongolia and Greenland. Yeah. So in terms of where we'd like to go with this, we're obviously at a juncture at the end of the EC funding, and we've had only limited resources to do this. This was a pilot. We would like to have more revolving content for the website and to continue to use it as an opportunity for junior researchers to actually publicise their research and to start writing for a very kind of user-friendly form of publication. We want to develop the Twitter site further. We want to engage more researchers in our Facebook group discussion, and also to engage young researchers that are not necessarily in universities, which we've obviously found much harder to do. But the question really is, how do we get to this future, especially now we're running out of EC funding? So really my thoughts are that we need to connect and collaborate more with other websites within the region, some of which are quite similar aims to ours. So we need to collaborate, we need to share our resources and to get together and to try to do that. We want to continue to publicise this network amongst our partner institutions and other public health organisations. And in an ideal world, I would like to have increased resources so that we can facilitate the training materials better, so that we can actually offer some mentorship to people who downloaded these materials to work through them, which at the moment we haven't been able to do except in a rather ad hoc way. We would like to embed this more in the region. It was perhaps useful to start it in London because we had access to IT expertise at the University of London, but we want to embed it in the region now. And we need to think about the language issues because it's in English, and we would like resources to have at least some of the content in the other key languages as well. So in planning our evaluation, what we found is that no one actually evaluates capacity building websites. We had a look. We found 89 websites on NCDs and public health globally, some in this region. We thought maybe that would give us some idea how to evaluate, but it doesn't really, because only 5 of them actually attempted to evaluate the success in any way. So what we are doing is when we return to our home institutions at the end of this meeting, we've designed a very brief questionnaire to send to our 246 respondents that we know their email addresses, to actually ask them about how they use the training materials, what they found useful, what they found difficult, and what they would ideally like to see there. Okay. So in terms of our discussion, moving on to a round table, we want to think about what the value of this kind of network is in the regional countries, particularly to junior researchers, to postgraduates and those outside universities, outside of academia. I would like to make it continuous an opportunity for junior and early career researchers to submit short articles based on their research, which we've been copy editing and publicising on the network. But there is obviously a key issue with sustainability beyond of EC funding. We know we can sustain this for a while, but our long-term future is something that we need to think about more. Oh, why can't I go? Oh, no, it's gone there now. And at the end, I just wanted to thank all of our partners, and I did have a little list of, well, it actually has gone through it, all of our partner institutions and their logos, but for some reason they didn't want me to show that one. So thank you for your attention.
bigger questions about issues for the...
I'm happy to take any type of questions or no questions if people are understandably too tired at this point in the afternoon.
But I think particularly if there's any factual questions, and then the bigger ones can be picked up on the panel.
Oh yes, that was my final slide, yeah.
Has this been written, published as such, not on the web, an article or...
I have half an article which I'm trying to write, and I was waiting for the final evaluation with the 246 partners that I think will make it into a stronger article, and I would be delighted if anyone from the region could talk to me about how best to get that published.
There's no UV here.
Pardon?
There's no UV.
There is AUB in Emerald. This is not the right one. You scrolled through to a MedChance one, not a RESCAP-MED one. So I apologise, but I do have the AUB in Emerald and just logos as well, yeah. But not on this slide, yeah. Yeah. I'd love to go straight on, yes.
Okay, well thanks very much, Julia, and also Sarah, Sarah Kerry, who's where's Sarah? Thanks very much. And Sarah has been busy tweeting through the the symposium. Thanks very much to Sarah.
Sarah's hiding, but she's the key person who's helped develop the technical side and the content, particularly over the last 6 months. Yeah. And I should thank her too, because that's been a...
But both of you have undertaken a really big task within RESCAP-MED, for which we're really grateful. Although you rightly said at the beginning this was designed as a pilot phase, I think we've gone further than we actually dreamed might be possible, and so that's great.